is there some red flags? Like if you were a business owner, like, hey, if you see these problems, you might want to question who you are employing here.
Yeah. Unfortunately, it's not as cut and dry as that. Usually you
There's
have
no
to dig a little
checklist, right?
bit,
Okay.
and you usually end up rolling back a few layers before you even get that far. But I mean, it always
Okay.
starts with number one, and you mentioned, how important leadership is. You know what? Teams are direct reflections of their leaders. So when I hear a dentist say to me, "Oh, I don't know, my team's so negative, and they don't do this, and they don't this, and na 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 na," and I'm like, "Oh, well, they're a reflection of the leader." Well, I'm not like that. And I said, let's reflect on our last 2 minutes of discussion. You said not, no, won't, and nothing positive. So
Yeah,
sometimes
yeah,
you
I've
go
seen that
live in
many
mirror on
times.
that. Yeah.
Yeah.
So the reflection of the leader is, okay, so what am I always, when I speak to the leaders and they say, she doesn't do this, or she won't do this, or this is with her, I'll say, well, what are you doing right now that might be leading or showing or modeling that behavior? And then we have a discussion about it. But it's not always that, obviously, right? But that's one scenario.
Yeah.
But what we do, if it is the employee, and we call them team members, not staff, because it's important not to call them an infection. We call them team members. And team members too, like using words, the certain words actually do help contribute to synergy in that. And that's a sidebar. But what we try to do is we try to rehabilitate the patient, rehabilitate the employee if there is an issue. So let's say it's a performance issue. The only way that you could tell whether or not it's a performance issue is you have to identify what the problem is, because sometimes it might not be a skill problem. It may be a behavior problem. So the first thing you want to do is, if somebody's doing or not doing something, is to find out whether or not, first of all, they knew that they were supposed to do it. Was it in their role? So role clarity is a huge
Yeah.
piece. The second part would be is, okay, so you're supposed to do it. Do you know how to do it? Well, were you trained to do it? Yeah, I was trained to do it. I understand how to do it. I've been doing it for years, whatever. So then you got to identify, then it's not that. Then it might be behavioral. I don't want to do it. I don't get paid enough to do it. She doesn't do it. Why should I? So now it's a
Yeah.
behavioral thing. So in all three of those different scenarios, you're going to have to approach that problem in a different way. If it's, I didn't know I had to do it, then you have a problem with your role description. Okay. Or there's a problem or a disconnect with the role description, or maybe there isn't one, or they don't know what it is. If it's the second one, and it is, well, I'm not aware of it. Well, maybe they weren't oriented properly, or maybe they need a little bit more support with training. And then the last one is, only they can tell you why it's a behavioral one, why they don't want to do it. Then it has to be solved in that way. But I think where a lot of people fail is that they make an assumption on, and the problem is whatever they have in their head is what they see it as, their perspective. And then they try to approach and attack the problem and solve it that way, which obviously, because it wasn't the initial problem, nothing gets solved, and then it's a cycle.